Hi class, I'm going to review with you some other things that you will view and observe on dental images. Trauma on dental images, fractures on dental images, luxation, resorption. So let's go ahead and get started. Trauma is an injury produced by an external force. That force may be on the crown of a tooth, may be on the root of a tooth, may be on the supporting bone where trauma occurs. Fracture, a fracture is the breaking of a part. Whenever a fracture is evident, whenever a patient comes in certainly with a fracture, fractured tooth, or you suspect a fracture, go ahead and take an image. Image examination is an essential part of the fracture evaluation. So crown fractures, of course, the portion of the tooth that's in the mouth most often involves anterior teeth. Now, this fracture can involve the enamel, it can involve the dentin and or the pulp. Here you see tooth number 8 with an incisal fracture, certainly into not only enamel, but dentin and pulp. And that image is allowing you and allowing the dentist to evaluate what type of subsequent treatment that fracture's going to need. A root fracture, most often, if one occurs, it's most often going to occur in the maxillary central region. Fractures can be vertical, going straight down the root. They can be horizontal. You can have one fracture in a root. You can have multiple fractures in a root. Having said that, root fractures are a lot less common than actual crown fractures. And both of these things happen in an accident, some kind of trauma, hit with a baseball bat, auto accident, falling off a bike. All of those things can lead to these crown or root fractures. With time, if the root fracture isn't observable on the initial image, with time, root fractures have a tendency to enlarge because there is swelling in the area of the fracture, edema, bleeding that tends to enlarge that root fracture. So, got an image here, tooth 9 with a horizontal root fracture. Tooth 9 had been previously root canal treated. Here's 10 as well, root canal treated. We've got a metal post in the root. This is very likely a lingual amalgam on 10 and a porcelain fused to metal or porcelain veneer crown. If the X-ray beam is parallel to the plane of the fracture, it will appear as a radiolucent line. So here we've got the X-ray beam was parallel to the plane of this fracture, and you can see that horizontal line. If the beam isn't parallel to the plane of the fracture, and of course you don't know where the fracture is, taking your initial films, sometimes the adjacent tooth structure obscures the fracture and you won't see it. The fracture won't be apparent and will only be seen as time goes on, again, as that swelling, as that edema occurs. Jaws fracture. Jaw fractures are most often observed in the mandible. Our panoramic image or cone beam computerized tomography are the best for visualizing mandibular fractures. Maxillary fractures are pretty difficult to detect on dental images, and they occur much less frequently. So here's an image, mandibular left fracture. You can see the mandibular canal here, right, where the inferior alveolar nerve travels, but that fracture has occurred. Trauma may displace teeth. It may move teeth. Trauma involves luxation. Luxation, the definition of luxation is the abnormal displacement of teeth. A tooth undergoing trauma can be intruded, pushed into the bone, or it can be extruded, come out of the bone. These types of images injuries require imaging and require imaging for years later. So in this picture, we've got tooth 8 has been intruded, it has been pushed up into the alveolar bone. On the right, we've got two extruded teeth, teeth 9 and 10, had some kind of trauma and have actually extruded. They have come out of the bone. Avulsion is when a tooth is completely out of the alveolar socket, completely out. So, you know, an example would be somebody's hit with a softball and the tooth is, again, completely knocked out of the socket. We have to take images at that point, look for any kind of bone fracture, just in emergency care, that the patient needs to contact their dentist ASAP. A tooth that's been avulsed should be reimplanted as soon as possible. When it is brought to the dentist or transferred, we keep it stored in milk or stored in saliva. The person can tuck that tooth in their cheek till they get to the dental office. So here we've got tooth 9 has been completely avulsed. If you take a dental image of that, what are you going to see? Well, you're going to see no root in the alveolar bone or in the socket. Resorption is another process that you'll observe in roots or on roots via images. Two kinds of resorption, physiologic and pathologic. Physiologic is normal, right? It's just normal primary teeth, baby teeth, the roots dissolving or resorbing as the child ages and the adult teeth are coming in. There is pathologic resorption that occurs due to a pathology. Depending on where that resorption occurs, we call it external resorption or internal resorption. External resorption is seen along the periphery of the root surface, the outside of the root surface. Most often, external resorption involves the apices of the teeth. The apex of the root will appear more blunted or shorter than the adjacent teeth. But lamina dura and bone around that blunted apex appear normal. Internal resorption is occurring within the crown of the tooth, within the pulp chamber, the pulp canals of the tooth. And in both cases, these are asymptomatic. There is no treatment for external resorption. For internal resorption, the treatment varies. Often you will see root canal-like treatment for internal resorption. We'll look at some images of internal resorption, but it is kind of mid-crown or mid-root. But here is normal physiologic resorption. Primary tooth T is being resorbed. We've got a little bit of the mesial root left. Tooth 29 is going to be erupting. That is normal, healthy, physiologic resorption. Pathologic resorption, take a look at tooth 9 here. This is in fact internal resorption, right? So that pulp chamber, that cementum is resorbing. It is going away. Here's external resorption, a flattening of that apex. This can occur because of trauma. One of the main traumas that causes external resorption is orthodontic movement, when orthodontic movement is too rapid. But the bone looks healthy around it. PDL looks healthy around it. Again, internal resorption here in tooth number 29, and that pulp chamber is resorbing. It is eating away at the cementum. For internal resorption, endodontic treatment is most often done. So here we have a lower incisor resorbing, and then that lower incisor after endodontic treatment. I'm going to stop here and then do a short video, a short audio on pulpal lesions.